Some people said, wow, I feel like I'm trying to apply to UCSF or to Harvard or to Stanford. And the submissions, but it broke down like this. These are the things that matter to us. What is the scope of the problem you're solving? What's the level of innovation you're solving? Clinical outcomes that you've achieved? What type of customer validation you have? And you'll note that we put a double value on that for the first round. Market traction, also a double value. We want to make sure that we're honoring companies that are in market today, because our goal at the end of the award show is we're going to go out and we're going to touch as many hospital systems, clinicians, clinics as we can, and share the information of who are these best companies. And so we wanted companies to really be in market. Ease of use was important. Cost savings. We want healthcare to be cheaper. So that was important. And how are you all differentiated? These were the important things in our judging criteria. With that, I'm going to introduce Dr. Iner Sawyer. And I've known Iner's on our advisory board at Health Hub. She's been thinking about innovation for years. And she's going to be working with today, helping me and really taking the lead and presenting announcing all these quarterfinalists. A little background on her. She is the Chief Health Innovation Officer of the Translational Research Institute for Space Health. That's at UCSF, and this is obviously an exciting, a brand new group that's working on things that quite honestly is probably not being worked on anywhere else in the world. She's the Director of Space Health at UCSF. She's also the co-director of the Center of Advanced 3D Technologies. She is the director at UCSF of the Skeletal Health Service, and she is in the orthopedics department of surgery at UCSF and has been here for a number of years and is probably one of the leaders in innovation in healthcare. Iner, turning it over to you.
Thank you, Mark. I'm really honored to have this opportunity today to be your Vanna White for the Digital Health Awards. I hope I can do as good a job as she does. I'm also very excited to talk a little bit, just a moment, about the convergence of factors in our world today that have caused a rapid uptick, an exponential uptick in the use of digital health technologies, not just in our country, but globally. Most of you know, referring to the COVID-19 forces that have been put in place, including that of the need for physical distancing, but also a need for really rapid innovation to combat a highly infectious pathogen. And both of these things have really pulled on people's innovation and ability to deploy even existing solutions in a more widespread manner. I think that when we look at why digital health has really taken off in this window, it's fairly obvious in some ways, but I think one of the things we've seen in the ecosystem is a big shift, not just in the interest, but in the public visibility of these tools that are being built and have been being built and may have not had widespread uptake, but are getting a lot of visibility now. There's been a lot of rapid innovation and iteration to actually meet the specific demands of COVID-19. Even some of the existing tools that we've been using in healthcare have pivoted specifically to that condition, but will have carryover and portability back to other chronic diseases. There's also been a widespread uptake, and this is really interesting, and this is by all stakeholders, where we previously were having trouble getting traction. Telemedicine is a good example of that. But a widespread deployment now. There's been trialing by necessity, partly out of just an urgency and putting our hands up and saying, we don't have a better option, and if this is low enough risk, let's go ahead and try it even without the evidence. There's also been a push under something called the Emergency Use Act, where the FDA has been allowing more deployment of technologies that they were doing slower approval processes on early. And again, those will need to be reassessed in terms of staying with the scientific rigor, but in terms of emergency, they were able to deploy them. And then there have also been rapid policy changes that have allowed this. So there's been changes in crossing state lines with credentialing. There's actually even been changes in the reimbursement for telehealth versus in-person. And then we've also seen significant increased investments in digital health at this time. For me, the big question is, which of these big inflections will remain once we do get back to a lifestyle that we've known previously, where we're able to commingle? So what of those driving forces will remain? What could we do to ensure that they remain, so that we could really see digital health create a new type of healthcare delivery system rather than just bolt on to the existing traditional healthcare system. So some of those forces that we need to ensure would be that the policy changes around reimbursement could continue to exist, or cross state line credentialing, et cetera. But also, I think we need to also continue to educate the investment community about what the capabilities are. And we have to do this both on the procurement side for healthcare, but also for investors. We have to do this by demonstrating that there has been effectiveness in care and cost. So I'm putting that out as a bit of a challenge and a charge to all of the companies to make sure that in this window where you're getting a lot of excitement, a lot of uptake, a lot of attention and deployment, please, please, please measure. Measure, has it been effective? Are we creating distributed but not diluted healthcare? And has it been cost effective at the same time? So effectiveness in care and cost will help us with the ongoing policy changes we want to implement, with the ongoing reimbursement, with the ongoing investments. So I'll turn it back over to you, Mark.
Excellent. That's a perfect intro. So here's what we're going to do, guys. We're basically we have 4 categories today. We're going to start with the best remote diagnostics companies. We're going to go through and we're going to announce those companies. And then we're going to go into our other 3 categories. So let's start with best remote diagnostic companies. And here are our quarterfinalists. Now, we're going to start now. AliveCor was our winner last year. So not only they were not allowed to apply this year, but they were obviously a very great winner. And we were really proud. And what we want to do is, cite our last year winners before we get into this year. So let's talk about, I jumped a little bit. How do we define basically remote diagnostics? Well, our definition around remote diagnostic is really the best product or service for remote patient monitoring and diagnostics. And really RPM went to the moon this year and back, and no longer could patients get to hospitals or get traditional diagnoses. So remote became really important, went from going from a nice have to a must have. And then wearables and all of other types of omics of all sorts becoming the new imperative. We've got, there are dozens of winners of companies and changes across departments and procedures ranging from the cardio area to cancer to orthopedics. All departments have changed because of remote diagnostics. And we're seeing our companies really reaching 3-year pro formas in 1 year. Aina, what would you add to remote diagnostics?
Well, I think the main thing we're seeing is we're going to be able to have real world evidence, and we can really better understand how a person's condition is playing out in the real world and how it's affecting them. Beyond that, though, we're adding quantitative information to the qualitative information that we have been getting through our traditional telehealth models and also through our traditional patient-reported outcome models. So looking at outcomes or looking at ongoing clinical care remotely, what has been left out a bit sometimes is the quantitative information, and that's what these remote diagnostics and remote monitoring tools will allow us.
Great. And with that, Aina, you're going to basically she's going to announce our quarterfinalists.
So Bina AI, very exciting company. Remedy, Serious Hope. Barty DX or Diagnostics. Baby Scripts. Conversa. Luco. Live Metric. CIRCADIA. DawnLight. Current Health. And Zeo by iRhythm. Really want to congratulate all the remote diagnostic quarterfinalists. These are all very exciting companies, and I look forward to engaging with you more, but also I'm looking forward to your presentation.
Look, these are our winners. Let me just say that we had some absolutely amazing folks that didn't win. We were really surprised by the number of companies that applied to this category. But look, these are winners. These are all great companies, and we look forward to their continued success as we move forward into the semifinal and to the final rounds. With that, we're going to now move into the next category. Our next category is Best Hospital Diagnostics Company. And so what's our definition there? Our definition is it's the best digital product or solution for hospital and clinical diagnostics. So the real difference between this and the last category is this is technology and diagnostics in a hospital as opposed to remote diagnostics outside of the hospital. Look, COVID impacted this area really as much as any area because look, you had scheduling, doctor scheduling was disrupted for a variety of reasons. We had elective procedures all backburnered, so all of these new things had to happen in hospitals, and it didn't necessarily mean that all of the technology and the diagnostic technology and the people were there in place, and so there was a need for more and more automation. And add to that was that EHR and integration improvements really started accelerating last year. So the ability for these diagnostic systems to tap into EHRs, into patient databases, really made them that much more powerful. Adding to that, the fact that you had payers and providers accepting and supporting more and more different patient biomarker types. So it's been a really, really big year in hospital diagnostics. And so all these companies have been benefiting from this year. So we're really excited to share. Now, last year's winner, we actually had two winners because we split the category last year. We focused on diagnostics in cardio and diagnostics in cancer. We had two great winners, one in nanoware and the other in Flatiron. So those were our winners for last year, and they could not apply this year. And with that, I'm going to turn it back over to you, Ainer.
Well, the hospital diagnostics category is extremely important. We talk about innovation outside the hospital, but it's absolutely just as essential that we keep moving forward with miniaturization, rapid turnaround of information, and integration of information within the hospital. Even the ability to understand how a patient's doing inside an ICU room became really critical at this point without having to change fully a full set of PPE each time we needed to understand the physiologic or biomarker parameters of that patient, and being able to get that information remotely, even if it's just outside a glass door, became really pivotal. The other part is we need to integrate the data streams in the hospital a lot better, whether it's imaging, clinical, or even subjective data. And that's really being forced by these innovations on the hospital diagnostics side. Because if we can get that information in, integrate it with the other data streams, we can then leverage clinical decision support, but we can also create more closed loop processes. So we can actually image something at the bedside with ultrasound and have, with the capability of AI, understand if the image is being captured correctly, but also get a near instantaneous interpretation and be able to act on it in the ER at the bedside without having to go through several layers of interpretation. And so these tools are augmenting the existing physician capabilities, and I think we're seeing significant improvements from that.
Excellent. Well, with that, we'll announce the winners. The quarterfinalists. Go ahead, Ainer.
This is Echo, GRAIL, Agendia, HeartFlow, Early Sense, Gauss, Breezing, Luminaire, Surgical Theater, Zebra. And I want to congratulate this group as well. As Mark mentioned before, this is the distillation of reviewing hundreds of outstanding companies, and you have really risen into the quarterfinal category because on your merit. So I, again, look forward to engaging with you, and I look forward to your more in-depth presentation.
Yeah, absolutely great group. Once again, this, again, super competitive category, great group, amazing winners or quarterfinalists going forward. In addition, a lot of other great companies that are going to be, be in next year and the year after's contest. So we're going to go to our third category. We want to keep things going here. Best telehealth company. Well, as you know, as we all know, if there was a category that sort of blew up this year, I think it's I think we all know it's probably this category was just went to the moon and back. Our definition of best telehealth company was really the best telemedicine product or service for improving patient outcomes. And again, thanks to COVID, we can thank COVID for something. Telehealth is really having its e-commerce moment. Many telehealth providers are on their way to becoming the Amazon of healthcare. You know, payers, providers accepted telehealth in a way that they hadn't accepted before. Telehealth basically went from being the new front door to many, if not all, procedures, simply because there were really no alternatives. Telehealth is going to stay. It's, you know, telehealth appointments were as high as 70%. The expectation is telehealth appointments probably will fall to 40% of all appointments. And so this was the year that it went from niche to mainstream. Super, super exciting year for telehealth. Einar, what would you add?
I agree with you, and it's been really exciting to understand better all the nuances of telehealth or distance medicine. I think the things we have seen is that the user ease has increased, and I mean that on all stakeholder sides. So provider use of ease, patient use of ease, et cetera. I think that that's been very, very important. It was thrust upon us, but people rapidly were able to figure out what worked, what didn't, and companies responded by making things easier. I also have seen more integration of quantitative data into these systems, not just qualitative, as I mentioned before. So even vital sign tracking or diagnostics that are remotely done entering into the telemedicine arena. And I think that also I've seen more integration across systems, because a lot of the telemedicine systems were initially set up as a parallel universe to the person's centralized healthcare. Not that the EHR is the center of the universe, but as a person moves across all these healthcare data generating venues, they need to have them integrate. So I think there have been huge advances that have happened rapidly because there was such demand. And I'd love to see policy and reimbursement. I'd love to see us keep up the pressure on those so they weren't just temporary. We have to figure out, though, finally, what are the right indications for this medium and what are the right patient populations for the medium. And I think we're learning that. So again, measure the effectiveness so we can really refine the indications for telemedicine, and it will continue to grow. Excellent.
Well, extremely well said. Last year's winner was Doctor on Demand. And Doctor on Demand is, we know they had a great year, understatement. And this was a picture from accepting at our ceremony last October. Well, with that, let's announce this year's quarterfinalists.
GoodRx, ZocDoc, Wheel, Physera, Vitrix Health, Hazel, Cecilia Health, Infinite MD, Mediquo, Circadia, Amwell, Datos or Datos. And congratulations to each of you. Again, because of your outstanding work, you have entered into the quarterfinalist category, but this again was out of hundreds and hundreds of applications. So thank you again for your efforts. Looking forward to learning more about you as you present more in depth.
Yeah, what a great category. With that, we're going to, this is our fourth and last category for this session. And we created a category we call it Best New EHR Advance. So what was our definition around that? It was the best product or service using data in electronic health records that can improve patient outcomes. So that wasn't necessarily another EHR system. We have some great established EHR systems out there. We're much more focused on those companies that basically were opening up EHR systems, helping EHR systems go from island to ocean, and making the data omnipresent and usable by absolutely everyone, be it patient, be it clinician, be it hospital, be it payer, It doesn't matter. And so the HR systems are finally opening up. New interoperability standards like FHIR are making a lot of this possible. The legacy companies are finally opening their systems up. What it results, look, we all know we need better UI. We need new types of patient facing UX. We're getting a lot of this. We're getting a lot of this from the big tech companies. We all need this data everywhere because, you know, pre-Tesla, you know, the analogy we all use was the EHR data was the gas that drives care. And so these are some really, you know, absolutely incredible companies that have opened this up. Anna, what would you add?
I think that was well said. I think there are several things that have shifted in this. One is I think there is a willingness amongst the big legacy systems to say, yes, we'd like to enhance the features and the capabilities of the EHR, and we can't do all of it. In fact, they've recognized that there's a real advantage to them in enhancing their own system if they can add more feature-rich capabilities. I think there's also less hesitancy on the side of the startups and the investors, because it became so difficult at one point that people were getting the advice to not bother to try to integrate with the EHR. And again, the difficulties were we were getting many fractionated types of streams of data that weren't really benefiting the patient or the provider. I think we're also having a more evolved understanding of what does it mean to integrate with the EHR. People used to say all the time, we've got to integrate with the EHR, but not understanding that there are many, many different types of data and not all of it is necessary. And the challenges around getting the information, just the information you need, or trading the information you need could be actually decreased if you knew exactly which data was important to integrate with. So knowing what you need when you talk about that.
That's great. That's great. So last year, two great companies. We had different categories. Again, we're learning. So we had a category last year called patient engagement around EHR, and a second category around interoperability. We've sort of munged them both together. Luma Health and Quiventus were basically our winners last year, and both of these companies had, in my mind, had breakout years since they accepted these awards. You know, and with that, Anna, it's all you.
RX Review, Cedar, Invitae, Human API, X Health, Ombra, Quiventus, Dr. Chrono, Avana Health, Health Note, IntelliHealth, Augmetics, Lean Toss. Again, congratulations to another quarterfinalist panel of winners here. I really want to congratulate you for the strength of your solutions that you've brought forward. And again, you were called out of a pile of hundreds, not a pile, but a collection of hundreds of companies that we reviewed. So thank you very much for applying and for the efforts you've put into making transformative healthcare solutions.
Echo that, huge category, and you know, companies, you guys are making an incredible difference.